Hi, my name is JP Oliveira. I'm the wandering clinician. I have zero time in my schedule to make videos, and so I have to do it while I'm driving, which is not maybe the smartest thing to do, but hey, and I'm wandering all right. I'm in my car. If you have not subscribed to my channel, please do, and that way you can be updated on the videos when I post them, which is seldom, but I'm doing my best. And you can always email me at jpdo.counselor@gmail.com. If you have a question you'd like me to answer via video, I'll do it. I'll keep your name out of it, be anonymous, but I will answer the question. So one of the thing that I've been talking a lot about lately to various patients is trauma. It's been very interesting because many people do not understand what trauma is. And so I want to talk to you about trauma, what it is, why people have it, and then how to get rid of it. So trauma is a response by your mind. Your mind, it's a maladaptive coping mechanism. It's a response that your mind develops as a result of a situation that's out of the ordinary, whether it's being in a house fire or being attacked, mugged, physical abuse, verbal abuse. Your mind, the trauma, the response that you have during that time, your high blood pressure, your fast breathing, your accelerated heart rate, your dizziness, your lack of oxygenation to the brain, and maybe a bunch of different neurotransmitters that are being pumped by your brain at the moment of the trauma, such as norepinephrine and endorphins, dopamine, cortisol levels that go up by the kidney. And so to help you, because there's a response when you get traumatized, there's a response that you might take. The first one is you might either flee the scene, which is try to get away as fast as you can, and so your body needs your heart needs to accelerate, so that's why you pump those neurotransmitters. Or you might fight, which requires you to be strong and have a lot of strength. Or you might freeze. And you see that in nature with all the animals. Some animals will fight, some animals will flee, and some animals will play dead. And then there's a fourth one, which is less common, which is called fawn, is when you try to seduce the person that's, or the situation that's threatening. So you turn on the charms, but that's more rare, and it's in various situations that are very particular. So if somebody is abusing you, or you sense that they might attack you, you might try to get in their head and be more pleasant so that they won't do that. So now that we've established the response to trauma in the moment, then we talk about after the trauma. So anytime someone is in a situation where they get immobilized, where they can't move, and where they feel a total loss of agency and afraid, it creates PTSD. So for example, in a car accident, you wake up on a gurney, your body is totally trapped on the gurney, you can't move any muscles, anything. You might have PTSD. You go in for a knee surgery and you are paralyzed waist down, and you can't feel anything, but you're on on the bed and you can't move, and somebody's cutting you open and operating on you. You can get PTSD. You are in a situation where somebody is holding you down and yelling at you. You'll get PTSD. You are someplace where you're frozen, you can't move in fear. Maybe you're being sexually abused and you're young and you don't know what to do and you're afraid for your life. You don't move and you're in fear. PTSD. So the brain responds to that, the trauma, is the maladaptive coping mechanism. So what happens when you've been traumatized? Well, some people will re-experience the trauma every time they have a trigger. So let's talk about triggers for a minute. You have various types of trigger. Think about all your senses: smell, touch, sound. Your basic senses. Seeing something, hearing something, touching something, tasting something, smelling something. All those can actually be triggers, depending on the situation. Let's say I talked many years ago with a lady that had been sexually assaulted in an environment where it smelled like coffee. Like coffee beans, very strong coffee beans. And so that woman could no longer have coffee, because every time she would smell coffee or come near coffee, she would get triggered to the point where she would re-experience the trauma. The smell of coffee triggered her. Noise, sound, let's say somebody attack you and they're 6 feet tall and dark-haired and light eyes and they look a certain way, and then you run into someone else in a different setting who resemble them, that could be a trigger as well. Anything that can revive the memory. So the trauma is inside of your body and it's not been processed. So let's say you are on your bicycle and you're riding your bicycle and you fall. You get up, your leg is shaking. You're shaking your body. The nervous system is processing the trauma and you're getting rid of it through shaking. When you're in a position where you can't shake your body, where you can't move your body, the trauma gets stored inside of your body, inside of the cell of the body. So literally you're storing that trauma inside of your body. So what happens? Well, working with a therapist, you can do, if you have one trauma, and I would recommend, like, for example, EMDR, if you have had one trauma and it's based on only one situation, not something that's repetitive, EMDR might be great. Eye movement, rapid desensitization. You also have brain spotting, and where you look at, you work with a trained therapist, and they look at the eye movement to reaccess, they look at the optical nerve to reaccess the part of the brain to be able to get the trauma out of your body. Then there are some practices such as rolfing, when you go see a rolfer, somebody who works on your body and moves the muscles around and get those movements inside of your muscle, that might release some of that trauma. And so you might experience, getting a rolfing session, you might experience grief, sadness, depression, anything that's stored and that's been blocked there. So there's a great book that's been written a few years back by Basil Garnacock called The Body Keeps the Score. And if you haven't read it and you want to find more about trauma, you should read it. EMDR, brain spotting, all those use bilateral brain activation. So when you are moving, let's say you've got both part of your brain engaged. So for example, you're talking and tapping, or you're talking and looking at a light going back and forth. It engages both part of your brain, which facilitate access to memories and also access to releasing trauma. And so the trauma is, I would say, the byproduct of a bad situation where you've been traumatized. Could be victim of war, abuse, witness to a crime, even something as mild as watching something on television that's traumatic could traumatize you. And then every time you get a trigger, I want to go back over that, every time you get a trigger, it reactivates it, and then you feel it. So ways that people with PTSD re-experience trauma, it could be through dreams, dissociation, hypervigilance, they feel it in their body, they feel aches, somatic issues like stomach, legs, arms, head, migraines. Sometimes they lose the ability to process information, that they feel like they can think, they can process information, they can speak, they can think, they can move, they get very as if their life is happening to them and they are watching it happen to them, and they don't always understand why, what's going on in the moment. They don't always know. So rule number one to dealing with the trauma is identifying your triggers, understanding what triggers it, and also realizing what kind of trauma you've experienced. And so once you know what triggers you have, then you can expose yourself. So it's exposure therapy, where you expose yourself to desensitize yourself to the trigger so you don't trigger the trauma. The other part of a trauma, processing your trauma, is working through it. And you could do narrative therapy, where you write the trauma from the beginning to the end, and you basically just express everything from point A to point Z, and you do it all. And then in narrative therapy, you ask to rewrite the end of how you wish things would have gone, so you can retrain your brain to have not to lie to yourself, but to experience a different set of feelings. You can use anchoring, like NLP anchoring, and I'd mentioned that before, where you basically remember a time in your life where you were doing really well and you were experiencing really good feelings, and maybe towards a particular situation that was really beautiful, where you were happy, your body was light, you were feeling good. And so when you do a guided visualization, what you're going to do is you're going to remember that time and really, really, really try to think it, not just in terms of, hey, let's say you're a day by the beach, right? And so not just the fact that you're there, but the sun on your skin, the wind, the noise of the birds, the sound of the waves crashing, the smell of the ocean, and how you felt. You felt relaxed, you felt good, you were laying down, you were breathing slow, your pulse was slow, you were calm. And so when you do your guided visualization, you just visualize all that. So when you encounter something that triggers you, you push the reset button and you go back to that place where you were calm and happy, and you revisualize that. It's a way of resetting the mood so you don't get dysregulated. And so the NLP anchoring is a really good method for people who have a tendency to get dysregulated. So finally, treatment for trauma. Treatment for trauma requires identifying your triggers, understanding the trauma, understanding that the way you respond to trauma is maladaptive, and coming up with an exposure therapy or desensitization so you don't get affected by the trauma anymore. And then go on living. It is very important that if you decide to do EMDR or brain spotting or whatever, you work with somebody who's trained, who has good experience. You don't want to get somebody working with you on that don't know what they're doing. And most EMDR, brain spotting, they have to go for training, and they will say, I've been trained. So it's very important. And I encourage you to journal every day. Do the gratitude like I've said in the other videos. Be grateful and try to concentrate on that, but it's okay for you to journal your feelings. It's important for you to become really aware of how you feel in the moment, so that the more aware you are of your own feelings, the more you realize how you're feeling in the moment, the easier it is for you to reset the tone and maybe use anchoring to get re-regulated, and also I acknowledge maybe the trigger that putting you in that space. And also, sometimes I meet people who have been traumatized and they tell their story, and every time they tell their story, they get re-traumatized. The importance of not re-traumatizing yourself, not putting yourself in a situation that's going to be traumatizing. That's why I tell people who have been victim of war not to watch the news, somebody who has maybe been a victim of sexual abuse, not to watch movies about sexual abuse, because the more you re-expose yourself, the more re-traumatized you are. Oh, I want to talk to you about CPTSD, which is complex post-traumatic stress disorder. If you're a victim of one trauma, your house burns down, that's a trauma that's very traumatic. That's PTSD. But if you are repeated to abuse day in, day out, every day of your life for a long period of time, you have multiple layers of abuse. That's called complex or compounded post-traumatic stress disorder. And that's even more difficult because you have to unpack one layer at a time. So EMDR is great when you're dealing with one situation. But when you're dealing with multiple situations, there are other forms of therapy that might be more appropriate, like CBT. And, ACT as well would be a good one. But the idea, your main therapy you want to do is CBT. And then give yourself some time. And if you are experiencing anxiety or depression, not everybody wants that, but you're talking to a medical doctor to get a prescription of an antidepressant to help you regulate yourself until you can regulate yourself through grounding exercise, through anchoring, through breathing, right? But if you are at a place where you're so dysregulated that you can't even do that, talking to a medical doctor might be helpful. I wish you all a great day. This was a brief overview. I was driving my car. And I look forward to hearing from you. And thank you very much for watching my channel.